Ravina, and this is my patient Rajiv. Hello. So today we'll be doing the 5 different kinds of medication administration. And before any medicine administration, first you're going to go over the patient's 5 rights. If you have the right patient, you're giving the medication at the right time, you're giving the right medication, the right dose, and the right route. And you also need the right reason for why you're giving the medication. So before you give any medication, first you'll be checking the MAR to see if you're giving the right medication at the right time. And so let's get started. For eye medications, the first thing you would do is you check the eyes for any redness or drainage. You would clean the eye starting from the inner part of eye to the outer part of eye. And then you would wash your hands, you would don clean gloves, and you would assemble all your necessary equipment, all your medications, everything that you'll need. You will tilt the patient's head back, and then use a non-dominant hand to put it right underneath the cheekbone and kind of pull down, and then have the patient look up. And you would drop the medication into the conjunctival sac, and then you put pressure on the inner canthus for about a minute or two. And if you need more than one medication, you would wait 1 to 5 minutes before administering the next one. You would discard all your supplies, you take off your gloves, you doff your gloves, and then you would document. For eardrops, you would position the patient so the affected ear is pointing upwards. So if we were to be giving the medication in the right ear, the left ear, his ear would be facing up this way. For any kid under the age of 3, we would pull the ear down and back, and if they are over the age of 3, it would be up and back. You would don your gloves, you would assess the ear for wax, and if there is wax, you would get an order for an irrigation. And so you shake the medication, and then you draw it into the dropper, and you would administer the medication, once again down and back if they're under 3, and up and back if they're over 3. And then you would apply pressure to the trachea to make sure that the medication is dispersed properly. Have the patient remain on this side for a few minutes, and if the other side needs medication, you'd have them like this for about 5 to 10 minutes, and then you would move to the other side and do the same thing all over again. Once again, you discard your gloves, you take them off, you document the right patient teachings, the time, the date, the medication, the dose, everything that's given. So for nasal sprays, first you would have the patient blow their nose, and then you would have them sit upright. You'd assess the nerves using a pen light, and then you block one nostril, you shake the bottle and insert into the open nostril immediately, and you would have them inhale through the nose while you're instilling the dropper in their nose. You would repeat in the other nostril if they need medication in the other nostril, and you would keep tissues on hand just in case they really need to blow their nose, or else you take off your gloves, you discard, you document the procedure, you document the patient, everything else. For inhalers, if the canister or medication is a suspension, you would shake the canister first. You would have the patient open their mouths, and you would place the inhaler within 2 to 4 inches, or if you're using an extender, they'd have the one side of the extender in their mouth and then close their lips around it. And let's see, you would have them inhale deeply with their mouth. After you activate the inhaler, you would have them hold their breath and let it out slowly so the medication can be dispersed. And if prescribed, you would repeat in about 2 to 3 minutes. You would have them rinse their mouths if their medication is a corticosteroid. And once again, take off your gloves, document the procedure. Injections. So if you're doing an intradermal injection, first you would verify that it's the correct patient, their 5 rights correct patient, the test that you're doing. You'd make sure that they haven't taken any antihistamine or inflammatory agents, and you'd make sure that they haven't been on any immunosuppressants for about 24 to 48 hours. You would cleanse the area for testing with an alcohol wipe, and you would prepare the solution for injection using aseptic technique. You would insert the needle about 15 inches with the needle bevel upwards, and you'd inject right below the skin, and then you remove the needle remove it quickly. And you do not wipe it with alcohol. You discard the needle without capping it. Just discard in a sharps container. You'd also give the patient information as to where and when to come back for the testing. And last but not least, G-tube feeding or G-tube medications. You would check the tube placement by aspirating their stomach contents, about 5 to 10 milliliters. You would use litmus paper, check the color to see if it's under 4, then you're in the right place. Then you'd put it back in. If you're using pills, you use a pill crusher, put them in different medication cups. You do not ever mix pills, and you do not crush enteric tablets. You would elevate the bed 30 to 45 degrees if they're in bed. And you flush with water before giving medications. So you flush before you give your first medication, after you give your first medication, after you give a second medication, and after you give a third medication. And so, yeah, after every single medication and before the first medication. And then you'd have the patient remain upright for about an hour to make sure all the medication is thoroughly dispersed. You would take off your gloves, you would document, do all the proper procedures. So basically, with every single procedure, you just have to make sure that you have checked the MAR, you have the right patient, you document it correctly. So you have the patient's name, you have the date, the time, your initials, any patient teachings, your signs and symptoms of the medication that you have given. And always make sure that you use 2 identifiers. I don't know if I've mentioned that, but you always use 2 identifiers before you give any kinds of medication. Before you do any types of assessments, you always have them, you check their bands, you have them say name, date of birth, and I guess that's all. Thank you. Bye.